Next, we have hydrocephalus. Hydrocephalus is an abnormal imbalance in the production and the absorption of CSF, which we have an abnormal accumulation of CSF within the ventricles of brain. So we have like four ventricles, and from first ventricle and the CSF flows to the other, next and third, and then fourth. And in this condition, we have two problems: either the CSF is produced too much, or secondly, the absorption of the CSF is abnormal imbalance due to any malformation within the brain, or any tumor, hemorrhage, infection, or any trauma. So which results into increase in size of head enlargement, and increase intracranial pressure that we call ICP, which happens due to the increase in amount of CSF in the brain. So we have four types of hydrocephalus: congenital, which is present by birth, and next we have acquired, which happens due to any injury, infection, tumor, and other medical condition after the birth. Communicating, in which the CSF flow between the ventricle but is blocked after it leaves the ventricle. So the flow between the ventricles is okay, but on the way there is a path like central canal. There it has the obstruction. So probably happens in the subarachnoid space. Non-communicating, which is the CSF does not flow within the ventricular system. So all the ventricles from 1 to 4, there is a blockage within the way, so it's not communicating at all. The symptoms are present like rapid increase in the size of the head, bulging fontanelle, soft spot on the top of the head that we call fontanelle, vomiting, sleepiness, irritability, porphyritic seizures, downward deviation of the eyes, which we call sunset eyes. You also see this in head injury. Older children have headache, vomiting, nausea, blood vision, congenital problems, coordination problems, and cognitive and personality changes, and difficulty walking up and staying awake, urinary incontinence, and late signs will be high shrill cry, so which is a sign of increased ICP. Next, treatment is the ventricular shunt. So what the ventricular peritoneal shunt. So what happened in this, they open the skull with a drill and put a tiny shunt from the brain to their stomach peritoneal cavity, which helps to remove the excessive amount of CSF from ventriculars to the peritoneal cavity. The second approach we have is endoscopic third ventriculostomy, a surgical procedure where we create a hole in the floor of the third ventricle, allowing the CSF to bypass the obstruction and flow toward the absorption sites around the brain. So this surgery is inside the brain. The other one is from brain to the abdomen. It's connected. So we have to do the shunt care if we do the surgery in this case. So you will remember it from shunt care. First, look for the signs of increased ICP. A head circumference should be monitored every day. If it's increasing, means they are still accumulating CSF. Understand the surgical procedure and what are the complications of each procedure. Neurological assessment, which will be GCS scores, and those movements we will see. Teach family and about the shunt care, like how to monitor the surgical site, and how to look for the signs of infection. And head should be frequently repositioned, and the accurate mattress will be used to avoid the pressure source in this case. Patient will be NPO preoperatively, so tell them not to give the baby anything. So head of the bed should be increased up to maximum 30 degrees, not more than that. And how to if the child is developing irritable, chill, high cry, and lethargy poor feeding, which means the shunt is blockish or there is infection. In a toddler, if they are having headache and lack of appetite, which is a sign of early shunt blockage. And in older children, change in mental status, like consciousness, level of consciousness, is a sign of malfunctioning of the shunt. So shunt can be blockaged after as well, so you have to be very careful when giving teaching to the parents. Regular follow-up appointments, education, and support the family. Ask them questions and encourage them to ask the questions if they have.